Hi, my name is Suresh and I'm the Principal Counsellor at the National Addictions Management Service. In my experience, most of the patients that I've worked with are employed, some of them in very responsible positions. In fact, overseas data shows that a majority of people with addictions do work. The belief that someone who is addicted is homeless, unemployed, unable to function at work or in life is not an accurate one. Some of the most prominent people in the world, people who have been very successful, have struggled with addictions for many years, and some were able to hide their addiction quite well, except to those who were closest to them. Hence, you might think that none of your colleagues or employees were likely to have an addiction problem. Again, this is related to the stereotype that addicted person is unable to function in life. In fact, as I said before, many highly successful people had struggled with addiction at some point in their life and in their professional careers. We assume that such colleagues are frequently absent from work, unreliable, not punctual, difficult to get along with, and show signs of, for example, the abuse of alcohol or drugs. Yes, sometimes our colleagues who had an addiction might show these signs, but many of them don't. Most addictive behaviors escalate and get worse over time. It might take years before other people actually suspected that this person had an addiction. We also need to be sensitive to the fact that these signs could signal problems other than addiction. For example, someone might be suffering from depression or some other mental health concern, or having personal and family problems. And sometimes a colleague might be displaying signs of stress because he or she was struggling to cope with the behavior of some other family member who had an addiction. It's widely accepted that 3 to 4 people are affected by the behavior of the addicted family member. Hence, addiction can impact your workplace through the behavior of people who are acquainted with someone who has an addiction, even if that person with the addiction is not working for you. This is untrue on so many fronts. Some of the most successful and productive people had struggled with addictions. Offering assistance, such as time off to attend treatment and therapy, makes better sense than getting rid of an employee who's valued and productive. This paints people into a corner and is very stigmatizing. It prevents people from seeking help and asking employers for assistance because they are concerned about the repercussions. Ironically, this actually causes people to spend more time trying to convince others that they didn't have a problem than actually finding help for it. It would be helpful to remind ourselves that one of the primary objectives of management science is to improve and increase productivity. If we focus on productivity as a goal, then we could start to reduce the stigma of addictions. In other words, our business practices and policies would be more productivity oriented, less judgmental, and less rooted in the sort of myths that I've been talking about, and to emphasize treatment as the best way to improve productivity rather than getting rid of employees who otherwise were doing well. The science tells us that treatment for addiction is effective, and people do change with the right support.